The top stories tonight in Y News. PhilHealth defends the release of funds to healthcare institutions amid the COVID-19 pandemic.
President Rodrigo Duterte warns he will not go after corrupt PhilHealth officials.
Find out the coverage of House Bill 6756 or the Medical Scholarship and Return Service Program Act. Beneficiaries of the second tranche of Social Amelioration Program in Las Piñas City spent their night lining up at a remittance center to receive financial assistance.
Several Filipino workers fly back to Thailand from the Philippines.
Australia's Northern Territory to keep its borders closed to COVID-19 hotspot states until 2022, while New Zealand reports 4 cases of community transmission. Good evening, Philippines and the world. Today is Tuesday, August 11, 2020. I am Horilyn Delgado.
Join us in the next hour as we deliver today's top stories around the globe. I'm Angelo Castro III.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am William Theo.
On the second hearing of the Senate Committee of the Whole today, PhilHealth officials defended the agency against the allegations of corruption and other irregularities. PhilHealth maintains that there were no irregularities in the Interim Reimbursement Mechanism, or IRM, for healthcare institutions affected by the COVID-19 pandemic. The agency says all reimbursements made have receipt and contracts.
Around the late April, we already began to have an idea of where the COVID incidence would be, which was the Region 3, 4, and I think 7 and NCR. But that time, we had already made sure that as much as possible, all the regions, especially the referral hospitals and the laboratories, had already a COVID fund ready. So that's the reason na hindi ho nagpantay-pantay ang pag-release ng COVID fund.
Okay. So parang
However, senators questioned the millions of funds released to dialysis centers in a short span of time, even though they are not catering to COVID-19 patients, while there are some COVID-19 referral hospitals that have not been receiving any reimbursements from PhilHealth.
20 million pesos, ang tagal lang sinisigil ng GAT, which is, I believe, is a government hospital, if I'm not mistaken. Anyway, 20 million. Ang binayaran nyo, B. Brown, ng 45 million. Dialysis center, walang COVID patient. But under the COVID-19 IRM.
if there's palakasan doon sa pag-release ng IRM na yan, by all means, let's investigate at tingnan po natin yan. Ang gusto ko lang linawin, Mr. President, na yung IRM funds is not only for COVID patients. At sinasabi na rin po ng paulit-ulit yun ng aming mga board members.
But one of the witnesses, PhilHealth board member Alejandro Cabading, believes there was favoritism in the release of COVID-19 funds.
On IRM. In your place in Iloilo, the reason why hindi yan nabigyan is because yung ano doon, the regional vice president doon is the perceived enemy of the Execom. Because she was the one, she was the one who supplied information that triggers the Senate hearing last year.
The regional vice president in Region 6, I was the one who assigned her in Region 6. And I had to reprimand her because she was slow in processing the IRM. So that is the story behind
Meanwhile, Etrobal Laborte, the former executive assistant of Morales, testified before the Senate. According to Laborte, there were anomalies in the bidding proper and procurement system in the agency. He also testified on the overpriced network switches, which was part of the 2.1 billion proposed information technology or IT system of PhilHealth. Witness former anti-fraud legal officer attorney Thorson Keith also claimed a new allegation of corruption which involved a 9 million peso benefit claim that was intended for deposit in a bank in Cagayan Valley but was allegedly diverted to a rural bank in Bataan. Presidential Anti-Corruption Commission or PACC Commissioner Greco Belgica also presented at the Senate some of the findings of the commission as proof of corruption in the agency. According to Belgica, it is the weak IT system, lack of validation process, and slow legal actions against fraudulent schemes that made the widespread corruption in the agency possible. He adds up to 3 billion pesos of PhilHealth releases each week was exposed to corruption.
Ang IT system na ginagamit ng PhilHealth ngayon has no validation mechanism, kaya na mamanipulate ng mga empleyado at ospital na hindi chine-check ng PhilHealth kung totoo ang mga claims nila. Bayad lang ng bayad ang PhilHealth ng parang tanga sa mga ospital habang ginagago naman ng tao.
Meanwhile, the Senate has also granted legislative immunity to the 3 witnesses.
Meanwhile, President Rodrigo Duterte warns he will go after corrupt PhilHealth officials. Our Malacanang correspondent Rosalie Cos explains why.
President Rodrigo Duterte vows to run after the corrupt officials and personnel of the Philippine Health Insurance Corporation or PhilHealth. According to the president, he will get rid of PhilHealth officials who would be held liable for acts of corruption.
Ako talaga, huwag kayong magkakamali. Itong PhilHealth, sabi ko, yayariin ko kayo. Maniwala kayo. Yung mga inosente naman, wala kayong dapat, tahimik lang kayo at continue working.
The president added if these people were able to evade prosecution for their corrupt activities during the previous administrations, he will make sure he will get them.
Pero yung ngayon ito, nakalusot kayo sa ibang maybe presidente. O dito sa akin, sad-sad talaga kayo. Maniwala. And with the help of mga cabinet members ko, hindi ko na lang ipagyabang. But these are people also. Simple lang. Why? Why are they really helping me to get rid of you? Kung maaari lang patayin ka, alam mo bakit? Because simply, they love their country.
Meanwhile, there are no details yet if the president would designate a new PhilHealth chief after the doctor of PhilHealth president and CEO Ricardo Morales advised him to take a leave of absence because of his serious medical condition. Whatever the decision of Morales, the palace expects the operation of PhilHealth will not be hampered.
Sa kahit anong organisasyon po, hindi naman po magkakaroon ng leadership vacuum. Kahit ano po maging desisyon ni General Morales, meron po talagang system in place para magpatuloy po ang trabaho ng kahit anong organisasyon sa gobyerno.
The chief executive will wait for the result of the investigation being undertaken by a task force which he had ordered to be organized by the Department of Justice. Rosalie Cos, UNTV News and Rescue. We serve the people, we give glory to God.
The Department of Health is continuously investigating reports of illegal trade of blood plasma in Cebu. Our health correspondent Aiko Miguel tells us why.
Some hospital staff and healthcare workers are allegedly involved in the illegal trade of blood plasma of COVID-19 survivor in Cebu province. The health department warns that individuals who will be proven to involve in this illegal act will face appropriate sanctions. The law states that medical professionals proven to be involved in such illegal trade will have their professional license be invalidated. This is in accordance with the DOH Administrative Order No. 36 or Rules and Regulations Implementing Republic Act No. 7719, otherwise known as the National Blood Services Act of 1994. According to the DOH, there are only 4 authorized facilities in the country which collect plasma from COVID-19 survivors. These are the Philippine Blood Center, the Philippine Red Cross at the Port Area, Manila City, St. Luke's Medical Center in Quezon City and in Taguig, and the University of the Philippines Philippine General Hospital in Manila. The DOH once again reminds the public it is risky to buy convalescent plasma, especially if not screened by a doctor.
Napaka-risky talaga. Kasi kapag ganyan, maraming sakit pa rin na natatransmit, no? When we sell our blood, lalo na yung mga hindi nasi-screen, nakakapag-transmit tayo ng transmissible infections, no? Na hindi dapat mangyari kung hindi natin pinagbebenta ang dugo.
Meanwhile, the DOH also warns licensed laboratories that do not submit reports on COVID-19 cases brought in their facilities. According to Undersecretary Vergere, Health Secretary Francisco Duque III had ordered to impose sanctions on non-compliant laboratories.
If they will not be compliant, there might be some form of warnings and then maybe suspension. So pinag-aaralan namin maigid.
Based on the DOH report, of the 100 licensed laboratories in the country, only more than 70% submit their reports and requirements. Some are delayed in submitting, while others do not submit at all. Undersecretary Vergere also adds the DOH and laboratories reconciliate their backlogs weekly. The DOH wants to be certain if there would no longer be duplicates in the country's total case count. Based on the August 9 COVID-19 report, 3,177 backlogs in laboratories need to be validated to ensure an accurate case count. Aiko Miguel, UNTV News and Rescue. We serve the people. We give glory to God.
President Rodrigo Duterte offers himself to be the first person to take the first shot of a Russian COVID-19 vaccine. Rosalie Cos details why.
President Rodrigo Duterte believes in the study done by Russian experts towards developing a vaccine that could cure SARS-CoV-2 infection or COVID-19.
Ako, pagdating ng bakuna, in public, para walang chat-chat yan, in public, magpa-injection ako. Ako yung maunang ma-experimentuhan. Okay para sa akin. That's my... Sabihin ko rin kay President Putin na tiwalang malaki ang tiwala mo sa your studies in combating COVID. And I believe that the vaccine that you have produced is really good for humanity.
The president is also happy with the Philippines' friendship with Russia and its President Vladimir Putin. According to President Duterte, the transcontinental country has expressed willingness to supply the Philippines with a vaccine or partner with a local firm for the mass production. The regulatory approval of Russia for the potential COVID-19 vaccine is expected within the month. President Duterte has directed the Department of Health to coordinate with Russia. He is optimistic the Philippines will be COVID-19 free by December. The palace, meanwhile, reiterates that once the COVID-19 vaccine arrives in the Philippines, it will still undergo a strict process to ensure public health.
Kinakailangan din nating sundin ang batas na umiiral sa Pilipinas, no, dahil nga po walang gamot na po pwedeng ibigay sa publiko na hindi dumadaan sa FDA. Ang FDA naman po hindi mag-i-issue ng permit to utilize isang gamot kung wala po yung clinical trial. So dadaan din po yan sa proseso natin yan.
Malacanang also defends the president against those who are saying that his public announcement on a potential COVID-19 vaccine is counterproductive. Presidential spokesperson Roque explained the president just wants to give hope to the Filipinos while reiterating to strictly observe health protocols designed to combat the infectious disease. Rosa Licoz, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, Russian President Vladimir Putin said today that Russia becomes the first country in the world to grant regulatory approval to a COVID-19 vaccine. This comes after less than 2 months of human testing. The vaccine was approval is a move hailed by Moscow as evidence of its scientific expertise. Speaking at a government meeting on state television, Putin said the vaccine developed by Moscow's Gamaleya Institute was safe, adding that it had been administered to one of his daughters. He said it works quite effectively, forms strong immunity, and has passed all the needed checks.
Meanwhile, the country's Department of Health says that 2,987 new cases were reported today based on the tests done by 74 out of 99 laboratories. The National Capital Region, or NCR, reported the most new cases with over 1,500. It is followed by Cavite with almost 400, while Laguna, Iloilo, and Cebu all reported more than 100 new confirmed cases. The total confirmed cases of coronavirus infections in the Philippines today reached close to 140,000. According to the DOH, 87 duplicates were removed from the total case count. There are 68,794 active cases as of today. Of those active cases, 91.6 are in mild condition. We have lost 19 more patients, but through our fervent prayers, medical interventions, and sacrifices of our medical frontliners, 280 more people have won their battle against the invisible enemy. That brings the total recoveries nationwide to 68,432. Thanks be to God.
Meanwhile, coronavirus cases around the world passed the 20 million mark. That's after countries reported more than 250,000 additional cases in the last 24 hours. The Americas remain to be the most affected region, contributing more than half of the world's total cases, while cases in Europe account for a quarter of the cumulative cases globally. On the other hand, nearly 6,000 new death cases have been reported globally since yesterday, bringing the death toll to over 730,000. While more than 12.3 billion patients across the globe have recovered from the new coronavirus infection. Thanks be to God.
Some private groups donate 5 million pesos worth of mobile disinfection machines to government hospitals in Quezon City. Meanwhile, non-governmental organizations call out to private sector seeking to help frontliners in their battle against COVID-19. Here's why from Asher Kadapan Jr.
Frontliners continue to receive outpouring support and help for their battle against COVID-19. To help ease their burden and worries, some private groups donated 6 mobile fully body disinfection machine and disinfectants to government hospitals in Quezon City. Among the initial recipients of the anti-COVID-19 equipment are the AFP General Hospital, PNP General Hospital, Philippine Orthopedic Center, Veterans Memorial Medical Center, Quezon City General Hospital, and Rosario Maclang Bautista General Hospital.
Meron tayo para sa mga soldiers, meron tayo para sa mga police, meron tayo para sa orthopedic, di ba? Ibang klaseng ospital yun. Tapos meron tayo para sa mga veterans, at meron tayo para sa yung mga talagang may hirap na pinupuntahan like Quezon City General Hospital at Rosario Maclang. So ang aim naman natin dito ay matulungan natin mga frontliners natin.
The disinfecting equipment checks an individual's temperature and automatically activates its disinfection process upon stepping into the machine. Health workers, on the other hand, express their gratitude for the machines that will alleviate their burden and worries brought about by the infectious disease.
In behalf po ng Quezon City General Hospital, Dr. Antonio, nagpapasalamat po ako sa donation ninyo itong machine, especially sa Rotary, District Governor dyan, at saka sa ating Congresswoman si Bernadette Herrera. Marami pong matutulungan na makailan na to.
Our appreciations to the donors. This will benefit to our patients coming from the bases of the entire AFP. So sa ngayon, overwhelmed yung facility natin. So makakatulong itong machine na to for the screening, initial screening. Doon pa lang sa pagpasok nila, ma-assure natin ang safety ng ating mga frontliners.
The disinfection tools cost a total of 5 million pesos funded by Reckitt Benckiser Philippines. Bagong Henerasyon Party List Representative Bernadette Herrera encourages stakeholders in the private sector who want to help the frontliners to partner with non-governmental organizations on the fight against COVID-19.
I am encouraging all multinational companies, please just keep on helping different organizations to do their social civic organizations. Alam ko due to hindi kayo pwedeng directly, so gamitin niyo po kami.
Asher Kadapan Jr., UNTV News and Rescue. We serve the people, we give glory to God.
Yesterday, the House of Representatives approved on the third and final reading a bill that would provide free education for Filipinos who aspire to become a doctor. Now, why is this proposed legislation important? One of our senior correspondents, Ray Pelayo, will tell us why live. Yes, Ray?
The pandemic has made every country realize the importance of a strong and reliable healthcare system. But as equally important as that is the necessity for healthcare providers and medical professionals, as we reported yesterday, the lower house of the Congress passed House Bill 6756, or the Medical Scholarship and Return Service Program Act, which is seen to answer to the lack of doctors in rural areas. Should a bill gets signed into law, all educational expenses and allowances of a medical student up to the licensure exam would be shouldered by the government. That means free tuition and other school fees, allowance for prescribed books, supplies and equipment, clothing for uniform allowance, allowance for dormitory or boarding house accommodation, transportation allowance, internship fees, including financial assistance during postgraduate internship, medical board review fees, annual medical insurance, other educational-related miscellaneous subsistence or living allowance. It would also mandate government and private schools to create a program for medical courses. The program would accept at least one student per municipality or as determined by the Department of Health. An applicant must be Filipino, a graduate of prerequisite medical course, passed the entrance exam, and was able to take the national medical admission test. After the graduation, the scholar should take a licensure exam within 1 year. If they failed twice, he would pay the amount of their scholarship. The scholar should give mandatory service from 6 to 7 years with appropriate salary and benefits. If refused to render mandatory service, he would pay twice the amount of the scholarship program. If the scholar refused to pay, his license would not be renewed. Arlene?
All right, thank you so much, Ray, for that report.
Some parents prefer to use television in the distance learning modality in the upcoming school year. Dante Amento tells us why.
The use of television is one of the learning modalities in the coming school year. Today, the Department of Education, or DepEd, started its TV test broadcast with several partner TV stations nationwide. The test broadcast will last until August 21, 3 days before the scheduled start of school year 2020-2021. In Mega Manila, learning materials are aired via IBC 13 and Solar Learning Channel from 8 a.m. to 6 p.m. These include different lessons for students in K-12 education and some lectures in learning management system. But Maria Cristina Balsa, who is both a teacher and a parent, says that she will prefer to have her kids use the blended learning system.
Okay naman din po yun sa TV. Siguro medyo mabilis lang talaga yung pagdi-discuss o yung facing nung lesson. Pero po siguro kung may module na hawak na kami or learning kits, mas masusundan po siguro ng mga bata.
Maganda naman po pero mabilis lang po.
Ronald Maria Cristina's husband, on the other hand, says they will just let their children use the TV if they have no time to personally supervise them.
Pwede naman po kung sakaling nawala ng internet, yan po yung isang option natin, TV.
Based on DepEd's survey, about 1.4 million parents choose TV as a better learning modality, while 900,000 others choose the radio. Both the TV and radio will be used as supplemental learning resources, but modular learning is the primary modality, as chosen by about 8.8 million parents.
Merong combination of TV and radio. So meron tayong programming na bawat araw merong mga asignatura na ipapalabas o i-air.
Dantiamento, UNTV, News and Rescue. We serve the people. We give glory to God.
The beneficiaries of the second tranche of the Social Amelioration Program spent their night lining up at the remittance center in Las Piñas to receive financial assistance. Some even slept on a footbridge just to be the first in line. Vincent Arboleda will tell us why.
Only 150 persons can be accommodated per day by a remittance center situated in Alabang Zapote Road, Las Piñas City. With a limited number of slots, several beneficiaries of the second tranche of the government's Social Amelioration Program lined up outside the remittance center last night. Some even came as early as 7 p.m. on Monday just to be the first in line to receive the aid.
Saan kayo natulog? Diyan lang po sa overpass. Dulo hanggang dulo ang pila, balikan. Ganyan, babalikan na naman. Sobrang dami namin.
According to Mary Christine, one of the waitlisted SAP2 beneficiaries, the 16,000 pesos that she would get is a huge help for her family. Rachel, another SAP2 beneficiary, had to leave her child with her neighbor so that she could fall in line.
Kasi para mahabol yung sir, kasi minsan nagka-cut off eh. Oo, hindi namin malaman. So ayun, kailangan talaga maaga.
The incident in Las Piñas has reached the Department of Social Welfare and Development. The DSWD says it is now looking for solutions to the matter.
Nakikipag-ugnayan po tayo dito sa ating mga FSPs at sa kanilang mga partner agents upang maresolba ang issue at maiwasan muli ito na mangyari.
DSWD USEC Reneglen Pahay adds that the distribution of the second tranche of SAP in the country is now at 86%. The Undersecretary adds they are optimistic to finish the distribution by August 15 this year. Based on the August 11 data from the DSWD, 73.07 billion pesos worth of SAP2 has been distributed to 12.1 million beneficiaries in the country. Vincent Arboleda, UNTV, News and Rescue. We serve the people. We give glory to God.
Meanwhile, the Light Rail Manila Corporation of LRMC will reduce the number of workers due to a decrease in ridership at LRT Line 1 as the COVID-19 pandemic continues to affect the country. According to the LRMC, a decrease in ridership comes with a decline in revenues due to quarantine restrictions and delayed projects. The layoff of more than 100 employees will begin on September 15. The LRMC Senior Management Committee consulted and met with the employment union to relay the decision. The LRMC assures affected employees will receive appropriate benefits in accordance with the Labor Department's guidelines. It has partnered with a company who will provide livelihood seminar to employees that will be affected by the layoff.
Now, here's a glimpse of what's the weather like in parts of the country. The southwest monsoon is affecting the western section of Luzon. State Weather Bureau Pagasa says the weather condition will bring cloudy skies with scattered rain showers and thunderstorms over Metro Manila, Ilocos Region, Batanes, Babuyan Group of Islands, Zambales, Bataan, Tarlac, Pampanga, Bulacan, Cavite, Laguna, Batangas, and Rizal. On the other hand, partly cloudy to cloudy skies with isolated rain showers will be felt over the rest of Luzon, Visayas, and Mindanao. Possible flash floods or landslides may occur during severe thunderstorms. No tropical cyclone advisory is issued.
Personal grudge and robbery are some of the motives the police are looking into for the killing of two male persons in Novaliches, Quezon City yesterday. But the police have yet to determine the real identity of one of the bodies. Our police correspondent, Leah Ilagan, tells us why.
The Quezon City Police District is still investigating if the body found in an apartment in Novaliches, Quezon City early Monday, bearing an ID of a certain Manuel Santiago, is the 72-year-old National Democratic Front of the Philippines or NDFP consultant, Randall Randy Echanis.
Manuel Santiago talaga ang pagkakilala sa kanya nung may-ari. Hindi tinanong namin na may nagsasabi ngayon na ito si Randy, ano ba yun, Echanis. Sabi niya, ay hindi, kasi ang pagkakilala dyan sa akin nung umupa dito, doon nag-issue nga siya ng statement na si Manuel talaga yun.
QCPD Director, Police Brigadier General Ronnie Montejo said they are still waiting for the relatives of Echanis to determine if the victim and Santiago are one and the same.
Kasi yung mga kamag-anak niya na in-encourage din natin na pupunta sa SIDO para magpaano sana issue ng statement. Wala pa rin dumating kaya hanggat wala pa, doon muna kami sana recover na idea sa kasi natin nung may-ari ng bahay.
Montejo adds they are looking into personal grudge as the possible motive for killing of Louie Tagapia and the Akyat Bahay criminal gang as the perpetrator of the crime.
Unang tinitingnan natin, yung mga modus ng yung Akyat Bahay, baka kakilala niya kasi hindi rin natin masabi kasi baka nagising ito. Siya naman siya tinitingnan natin. Yung si Louie Tagapia, may tattoo na yung Sputnik gang. Kalalabas lang din pala nito yung kaso niya illegal drugs para personal grudge sa kanya.
Montejo brushed off the allegation that certain policemen are behind the killings.
Hindi ko malayo kasi wala namang polis na pumapatay na nung taksak na ba yung gawin niya pa rin niya. Nalapitan pa niya, lalo niyang delikado.
Police official also explains what happened was not a police raid because they did not receive any coordination or call from any QCPD unit for an operation against Santiago and Tagapia. Montejo also clarifies why the police transported Santiago's remains back to Pink Petals funeral home.
Nag-complain kasi yung may-ari doon sa na niloko siya. Yung may-ari ng funeral parlor. Hindi ko alam kung nabayaran na sila o niloko na pinakuha daw ng parang gano'n rin nga allegation kaya binigay niya. Kasi police din ang ginamit. Na okay na raw sa kinuha, dinalik. Tapos, ongoing pa kasi yung investigation.
Meanwhile, a paralegal of Centro para sa tunay na reformang agraryo or Centra has been arrested for obstruction of justice when he tried to take Santiago's remains.
Kunwari na kamag-anak, tapos niloko yung supervision ba yun, ang punerarya?
But Karapatan Legal Counsel Attorney Maria Sol Taules said Paulo Colabres has the right to claim the remains because he has a special power of attorney from the victim's relatives.
They are claiming legally their right to recover the body para i-turn over doon sa pamilya. And they have the authority dahil meron silang special power of attorney na dala-dala nung time na yon together with the lawyer.
Santiago and Tagapia were found dead in an apartment in Novaliches, Quezon City on Monday with stab wounds. The suspects in the killing remain unidentified. Leia Ilagan, UNTV, News and Rescue. We serve the people, we give glory to God.
The family of slain Anakpawi's chair, Randall Echanis, wants an independent autopsy on his remains. Joanano tells us why.
To be able to identify the real cause of his death, the wife of slain Anakpawi's chair, Randall Randy Echanis, wants an independent autopsy on the remains of her husband. Erlinda Echanis and their legal counsel returned to Pink Petals Funeral Homes this morning to demand the release of Randy's remains. She confirmed that the body was that of her husband, but the funeral did not allow her to see the remains. Instead, she was permitted to see the picture.
Nananawagan po kami na ibalik na ang aking asawa na si Randall Echanis. Ibalik na sa pamilya. Sa ngayon, hindi pa po pinapakita ang bangkay. Video message lang po na pinakita sa akin ang mukha.
The family insisted that the funeral home should release Randy's body and that the police not hold its release. The legal counsel of the Echanis family argues that under the law, the family has the right or jurisdiction over the remains of Randy and not the police. They also questioned the move of the police when they withdrew the body of Randy Echanis from another funeral parlor and returned it to Pink Petals Funeral Services without the consent of the family.
For them to require and to hold the body back again, there should be a court order which was not presented to the family and to the legal counsel of the deceased. So walang legal na batayan ang paghawak nila at pagbawi sa katawan ng bangkay.
Meanwhile, the legal counsel also questions the arrest of the paralegal who attempted to withdraw Randy's remains from the funeral homes, allegedly without coordinating with the police. Joanano, UNTV News and Rescue. We serve the people, we give glory to God.
And for the news abroad, here's Kath Dumaraos live from Bangkok, Thailand. Good evening, Kath. Yes, what have you got for us tonight? Yes, Kath, what have you got for
William,
us?
some 160 Filipinos, OFWs, and some of their dependents were able to fly back to Thailand from the Philippines through a chartered flight last Saturday, August 8. I will also tell you why after 101 days with zero community transmission, New Zealand goes into lockdown again.
Okay, go ahead, Kath. Please tell us why.
Overseas Filipino workers in Thailand who went home for the holidays got stranded in the Philippines after lockdowns were implemented in both countries due to the coronavirus disease 2019. As a result, the OFWs made a request to the Royal Thai Embassy in the Philippines to allow them to fly back to Thailand. But it was not without any obstacles. The Filipino workers needed to submit requirements to the Royal Thai Embassy, such as a certificate of employment, insurance certificate, and their work permit. They were also required to book a hotel for at least 15 days as an alternative state quarantine, as well as take a coronavirus test 72 hours before the scheduled flight. A second batch of Filipinos is scheduled to come back here in Thailand on August 25th. Let's now take a closer look at the updated count of coronavirus cases in countries worst hit by the pandemic. Cases in the USA surpass 5 million, Brazil passes 3 million, and India now has over 2 million confirmed cases. Deaths in the United States have reached more than 163,000. Also note that Africa now has more than 563,000 as of today. Australia's Northern Territory will keep its borders closed to visitors from COVID-19 hotspot states until 2022. Also, the death rate among aged care facilities in Australia is among the highest in the world. Joining us tonight is one of our correspondents in Australia, Marvy Delphin, to tell us why. Live. Marvy?
Yes, until today, the Northern Territory has only 34 confirmed cases of coronavirus infection, and 32 of those patients have already recovered. There are no death cases due to COVID-19 in the territory. Now, the Northern Territory government has decided to extend its border closure for at least 18 more months, while its closure for Victoria will remain indefinite. Chief Minister Michael Gunner said the decision to maintain hard borders was made to protect the territory's vulnerable remote indigenous population. He also said the territory has been recruiting extra police to keep hard border controls in place. More health staff are also hired to help with screening at airports. Anyone coming from Sydney or Victoria will have to complete 2 weeks of quarantine at their own expense if they want to enter the territory, while Northern Territory's residents are encouraged to stay within the territory for their safety amid the pandemic. Meanwhile, the tragedy unfolding in aged care homes in Australia has prompted the Royal Commission into Aged Care Quality and Care to examine the response to COVID-19 in the embattled industry in a 3-day hearing in Sydney, which started this Monday. As Australia grapples with its aging population and the COVID-19 crisis, the country has witnessed aged care residents accounting for the 203 out of the nation's COVID-19 death toll of 290. That is approximately 68%, making Australia one of the highest aged care COVID-19 death rates in the world. The aged care sector is also bracing a record yearly drop in occupancy levels as it reels from the impact of the pandemic. The declining rates of occupancy has flagged concerns for the aged care sector's ability to recover after the COVID-19 crisis. Australian families, aged care residents, and workers now fear that there may be no hope of fighting COVID-19 and protecting the residents in the nursing homes if the various levels of governments are not effectively collaborating and planning enough to decide who would call the shots in the event of an outbreak. Kath?
Marvi, with the present situation in aged care homes, are families still advised to send their elderly relatives to those facilities?
Kath, despite the raised issues, the government still urges that in many cases, aged care homes was still the safest place for older Australians to be, and encourages families to consult any prospective facilities about their COVID-19 planning and safety measures, like screening procedures and nurse-to-patient ratios. Kath?
Marvi, if the border closure is for 18 more months, what about the holidays? How would Territorians spend their holidays?
Well, Chief Minister Gunner advises Territorians that if they could, they should cancel their December holiday plans and stay, because for Gunner, it's Territorians first. Actually, the border announcement comes just one day after Prime Minister Scott Morrison said that he was against the odds, hopeful that there would be a relaxation of some restrictions by the coming holiday season. But Gunner said he thinks it's unlikely that we are able to move back to a restriction-free society, and added that he doubts that is going to happen. Kath?
All right, Marvi, thank you for that report and stay safe in Australia. Prime Minister Jacinda Ardern has announced Auckland will go into lockdown and the rest of the country will go into level 2. It comes after 4 cases of community transmission from the same family were confirmed after almost 100 days without any. Ardern and Director General of Health Ashley Bloomsfield announced the news tonight, and an alert was sent to New Zealanders' phones. As of noon tomorrow, Auckland will move to level 3 for 3 days until midnight on Friday. The rest of the country will move to alert level 2 at midday tomorrow until midnight on Friday. The area covered by level 3 is the Auckland Super City, from Wells Ford in the north to Pukekohe in the south. Schools will close unless they had students whose parents were essential workers. Public facilities, bars, restaurants, and businesses must close tomorrow. Pharmacies and supermarkets will remain open, but Ardern said there was no reason to panic buy. Aucklanders should use a mask if they leave the house to access essential services. The rest of the country should wear masks in situations where they can socially distance. Elsewhere in the UK, So schools and colleges will reopen full-time in September as determined earlier by the government. UK Prime Minister Boris Johnson visited St. Joseph's Catholic Primary School and Sacred Heart of Mary Girls' School in Upminster, England, to find out how the schools are preparing for the return of all students next month. Keeping our schools closed a moment longer than absolutely necessary is socially intolerable, economically unstable, and morally indefensible, says the UK Prime Minister. The British Department for Education has already laid out its detailed plans for the school reopening, such as where there is a positive case in a school or college, where an outbreak in a school is confirmed, access to testing, and others. Schools are asked to keep children in class or year group-sized bubbles and encourage older children to keep their distance from each other and staff where possible.
It's absolutely crucial all our kids get back to school in September. By far the best thing, both for their mental well-being, but also for their physical well-being as well, for their health as well.
And those are the reasons behind the news here in Thailand and in other parts of the globe. Back to you, William.
Thank you, Kath Dumaraos. Stay safe there in Bangkok, Thailand.
Pregnant women with COVID-19 more likely to require intensive care admission than their non-pregnant peers. Here's why from Jovic Bermas.
The United States Centers for Disease Control, or CDC, has recently published coronavirus infections in unborn children appear to be rare and less likely to affect early fetal development. However, emerging data show that pregnancy does appear to make women's bodies more at risk to suffer from severe COVID-19. This is partly due to the pregnant women's adjusted immune systems and already stressed lungs and heart, the coronavirus points of attack. According to available data, among the 91,412 COVID-19 infected women of reproductive age, 50% of the 8,207 who were pregnant were more likely to be admitted in intensive care units than their non-pregnant peers. They are also 70% more likely to require ventilators, the machines that help seriously ill patients to breathe, although they were no more likely to die. An expert on emerging infectious diseases and pregnancy at Lausanne University, Dr. David Bod, told caregivers to protect pregnant women who are the first ones who need masks and the first ones to avoid social contact. Dr. Denise Jamieson, Chair of Obstetrics and Gynecology at Emory University School of Medicine, noted, as the womb grows, there is less and less room for the lungs, hence pregnant women often feel short of breath. While pregnant women's blood has an increased tendency to clot to prevent them from bleeding massively immediately after childbirth, COVID-19 itself can have a similar effect, which further increases the likelihood of clotting. The heart is also strained as it is already working for two, Dr. Bod added. Meanwhile, in a study published by Public Health Agency of Sweden using a more complete data set, researchers found only 13 coronavirus-infected pregnant women and 14 non-pregnant infected women were admitted to Swedish ICUs between March and April. This means COVID-positive pregnant women and those who just gave birth were nearly 6 times as likely to land in ICUs as their non-pregnant COVID-19 infected peers. Researchers, however, believe that better data are still needed to understand and address the risks to pregnant coronavirus-infected women. Jovic Bermas, UNTV News and Rescue. We serve the people. We give glory to God.
The Perseid meteor shower happens in the next few hours, according to NASA, or National Aeronautics and Space Administration. With comet Neowise making its way out of the solar system, it is time for a celestial show caused by a different comet. Perseid meteors caused by debris left behind by the comet's swift tuttle began streaking across the skies in late July and will peak in the pre-dawn hours of August 12. The Perseid meteor shower is often considered to be one of the best meteor showers of the year due to its high rates and pleasant late summer temperatures. NASA says that it is best to make plans to stay up late the night of August 11 or wake up early the morning of August 12. The Perseids are best seen between about 2 o'clock in the morning your local time and dawn. But what if the weather does not cooperate? A live broadcast of the meteor shower from a camera at NASA's Marshall Space Flight Center in Huntsville, Alabama will be available on the NASA Meteor Watch Facebook starting around 8 p.m. CDT on August 11 and continuing until sunrise of August 12. Meteor videos recorded by the NASA All-Sky Fireball Network are also available each morning. To identify Perseids in these videos, look for events labeled per. And those are the reasons behind the news August 11, 2020. I am Horlin Delgado. We serve the people. We give glory to God.
Reasons we deliver to you as they unfold. I'm Angelo Castro III.
And I am William Theo. Because we need to know, we will always ask why. Have a great evening.